Hi, my name is David Schuster. I am the Director of Nuclear Medicine and Molecular Imaging at Emory University in Atlanta. So when we discuss radiation exposure for the patient, we use the term ALARA, as low as reasonably achievable, and we try to work toward that goal. Yet, much has been written recently about the dangers of radiation and imaging, resulting in what I would call unreasonable fear. Numbers are thrown out that, for example, with X level of radiation, this will give you a certain risk of future cancer. While these numbers may be useful on the population level when trying to craft regulations, they have little to no meaning on the individual level. These scans can be life-saving, and there is no reason to avoid them simply due to a fear of radiation. Of course, we should only do imaging when it is medically necessary. But all risks are relative, so let us talk about relative risk. Number one, the amount of radiation from a PET CT is about 1/5 of what is allowed each year for a radiation worker, which in itself is a very conservative level. Number two, radiation risk decreases significantly after age 40. Most cancer patients are in this age group. With young people or pediatric cancers, we do make an extra effort to use even less radiation. Number three, the therapies that we will employ to help cure the patient from what is a deadly disease have far more risk than the small theoretical risk from diagnostic radiation exposure. If radiation therapy is utilized, that level of radiation is much higher than a PET scan. And number four, finally, the risk to one's life from getting into a car accident on the way to your scan is actually far higher than any risk from the scan itself.